Hawks, would you happen to have anything to do with why the weather is bad today?
No, I cannot think of anything I've done in the past 24 hours to warrant this. Also, that's a bit of a stupid question, isn't it?
It's just that I don't think I've ever seen rain before, Hawks.
When you're done staring at the drizzling miracle out the window, how about we talk about the patient of the day?
Oh yeah, we have one of those.
Alright, so let's analyze these symptoms.
It does seem like a combination of all three would be quite unusual, don't you think?
I agree with Leslie. This patient's condition is not something I've seen before. But we mustn't rush to conclusions without further investigation.
I couldn't agree more.
We need to gather more data and examine the patient thoroughly. It would be a disservice if we make a diagnosis without sufficient evidence.
But Hawks isn't ignoring possible explanations against our professional ethics.
I think you're missing the point here. Our priorities should be the well-being and safety of the patient.
Absolutely, Randall.
We must not compromise on that. If we make a misdiagnosis or an ill-advised treatment decision, it could lead to serious complications.
Listen up, I've made my diagnosis.
And what would this course of action be, Hawks?
Oh boy, this doesn't sound good.
Hawks, are you sure about this decision?
Yeah, I'm pretty damn sure. And for your information, we're gonna perform a buttocectomy on the patient.
Wait, did you just say
Buttocectomy? Hawks? That's risky.
Very risky indeed.
I know it is, but that's what I think we need to do here.
Hawks. Are you out of your mind? Are you seriously suggesting we're supposed to remove one of the patient's buttocks because you don't have any better ideas?
But that to me isn't even a recognized procedure, Hawks.
Trust me, it's all part of the plan. Now get to work.
Hawks, I called you in here because we need to discuss your decision about performing a buttocectomy on one of our patients.
Yes, Tracy, I believe that my patient has epispadias and needs this procedure.
First of all, to avoid another cranioectomy incident, can you describe to me what you expect to happen with what you call a buttocectomy?
I expect the removal of one or both of the patient's buttocks.
Second, where did you get the idea to perform a novel surgery on your patient? It sounds like an extreme measure and something that we should not take lightly.
I assure you, Tracy, my decision was based on solid medical knowledge. I learned this procedure from a highly regarded mafia doctor who has been doing this for years. His success rate is unmatched.
I swear every week you are coming up with more insane backstories to your stupid ideas.
This mobster was not to be messed with. He was known as Two Chance Chop. When the money didn't come in, he'd remove one buttock as a warning to their own crew.
There's no way you're telling the truth, and somehow, with both of your butt cheeks intact.
I never crossed Two Chance Chop. Sometimes he took both cheeks out in one swoop.
This is beyond stupid. Don't go through with it.
I can't believe it. The patient is in critical condition.
What? What happened, Randall?
What do you think? The buttocectomy, Frank. It didn't work out as planned. We must have missed something crucial.
Well, I guess we should go back in and take out the other buttock. Obviously, we've removed the wrong one.
Frank, Hawks is a complete moron. How are you not seeing this yet?
I know what you mean, Randall. I think we need to reconsider the treatment options.
Absolutely. We can't keep relying on Dr. Hawks's methods. They were flawed from the get-go.
Maybe we should consult another expert. Someone with more experience in this area.
A great idea, Frank. Just who else in this hospital has experience removing buttocks from people with epispadias?
I think it's time we reached out to Dr. Johnson, the renowned epispadia specialist.
What?
Dr. Johnson would surely help us understand what went wrong and guide us towards the right treatment.
Frank, Johnson works in oncology, not the urethra nor the buttocks.
What does the urethra have to do with this?
Of course, you don't know what epispadias is, Frank. Of course you don't.
Wonderful. You wastes of space nearly killed that man.
What do you think the actual diagnosis is?
Yeah, what could it be?
I still don't understand why we performed buttocectomy.
The man had epispadias. You didn't even take a minute to check if he was alive after the buttocectomy.
Yes, we did, Hawks. That's part of our job description. The part you're having trouble understanding is ensuring the operation is relevant to your patient's condition. Do you think people piss out their butts or something?
Wait, epispadias is a urethritic condition?
Oh, for the love of God, who is swapping the idiocy around here? I'd expect Frank to make that mistake, not you.
Lest we forget the time Hawks made us decapitate a man.
To death!
Lest we forget that Frank here probably only removed one buttock and not the right one.
Well, tell us, genius, which was supposed to be the right buttock.
The one on the right. Here, let me demonstrate with my middle fingers what's on the left and what's on the right.
Hawks, shut up. This isn't helping anyone. We've ruined a patient for no reason because you don't know medical definitions.
That's right. I agree with Leslie.
And your biggest fault is in letting Frank anywhere near the patient when he has a history of continually maiming them both due to his incompetence and your enabling of it.
I do not agree with Leslie.
Okay, we should all calm down. I'm gonna get lunch and admit I was incorrect about everything today. Check on the patient and make sure they're not trying to sit where the ectomy butt cheek was. So, how are things going in oncology these days, Johnson?
Oh, the usual. We're doing our best to keep everyone comfortable. Though I did have a bizarre conversation with a couple of your doctors earlier today. They were convinced I was well versed in buttocectomies and epispadia.
Don't know what that would be about. Interesting times. Speaking of which, let me tell you about this weird case I've been dealing with.
Weird cases are always fun to hear about. What's got you stumped?
Well, it's a bit complicated, but it seems like our patient is suffering from some rare form of... Johnson, I figured it out. Let me just get back to my lab. It's been great catching up, though.
Damn, I was hoping you'd explain what this whole buttocectomy thing is.
You can't be that dense. Listen up, everyone. I've just discovered an error in the epispadias diagnosis.
And what are you doing without proper protective gear? You're a walking hazard.
I couldn't agree more. Your negligence is putting us all at risk.
Ignore their petty complaints. I've identified a new diagnosis of severe congenital neutropenia.
You can't just dismiss our concerns like that. Hawks. We need to follow protocols.
What's the prognosis for this severe congenital neutropenia?
The patient has a high risk of developing infections. However, I'm confident we can manage it.
That might be true, but you should at least have a conversation with Dr. Johnson before making such bold claims.
And perhaps put on the protective equipment required for this room.
You know what? You're right. My apologies for the oversight. Now let's get started.
Well, that will have to wait. When you said it was an aorta issue, I took the initiative to perform an ectomy on half of the heart.
Please say psych.
Psych.
You did not just remove half of the patient's heart.
I did.
All right, team. There are two things we can work with. One, there better be a heart donor on speed dial. If not, get in contact with the new hospital chaplain. That's about as close to anyone you can talk to if you want to save your souls. Man, I can't believe I let my ego get in the way of actually doing my job. You're right. It was stupid.
It wasn't just stupid, it was deadly. How did we go in one afternoon from someone's buttock being removed to dying in the operating room?
I'm not really sure. I didn't order anyone to operate on the heart.
That surely didn't stop one of them from trying.
What can I say? My doctors are extraordinary.
Your doctors, and you by extension, are liabilities.
Whatever. I don't have anything left to comment on today's bizarre happenings. It's time for me to go home.
So that's it? No punchline?
Punchline. Are you sick or something, Tracy? A patient died today and Chaplain John had no time to get down there.
Chaplain John. That's his name. I thought he was related to the bartender, not the same person.
Yeah, apparently chaplaining is his main gig now. He says he started to see the light.
Well, I look forward to whatever he has to say about you and your doctors.
In the eyes of the Lord, all will face judgment, even if their efforts are half-hearted and half-assed. There's my salvation in exchange for your punchline. Never speak to me again.